Addiction, often perceived as a standalone issue, is a complex challenge that intertwines with various aspects of an individual's life and psyche. At its core, addiction is not just about the compulsive use of substances but a symptom of deeper, underlying issues, with trauma frequently playing a pivotal role. Trauma can stem from childhood experiences, accidents, or emotional hardships, and it can significantly alter an individual's emotional landscape, potentially setting the stage for substance abuse as a coping mechanism. Roger Farahmand, an entrepreneur with a deep understanding of mental health, delves into the relationship between trauma and addiction. Understanding trauma and its impact on the psyche. The term trauma often conjures images of physical injuries, but its impact extends far beyond the confines of bodily harm. Trauma encompasses a range of experiences that cause intense physical, emotional, or psychological distress. Trauma can result from various events, such as severe accidents, natural disasters, military combat, personal assaults, or even chronic emotional abuse. Emotional or psychological trauma, while not always visible, can be just as debilitating as physical wounds, profoundly affecting an individual's mental health and overall well-being. The impact of trauma on brain chemistry and behavior is profound and a starting point for a discussion on addiction, says Roger Farahmand. When a person experiences trauma, their brain undergoes significant changes, particularly in areas responsible for emotion regulation, memory, and stress response. Traumatic experiences can significantly increase an individual's vulnerability to addiction. Drugs and alcohol can provide a short-lived sense of relief or numbness, making them appealing to individuals grappling with unresolved trauma. The temporary relief provided by substances diminishes over time, leading to increased usage and, ultimately, addiction. This cycle perpetuates a destructive path where both trauma and addiction reinforce each other, creating a complex web that is challenging to untangle. The trauma-addiction cycle. The intersection of trauma and addiction forms a dangerous cycle, often rooted in substance abuse as a coping mechanism for traumatic experiences. Individuals suffering from trauma may turn to drugs or alcohol as a means to numb their pain, escape their reality, or even momentarily reclaim a sense of control lost in their traumatic experiences. Notes Roger Farahmand, this self-medication may provide temporary relief, but so often we see it set the stage for a dangerous interaction between trauma and addiction. The cycle of trauma and addiction is often perpetuated by the shame and isolation felt by those trapped within it. The stigma surrounding both mental health and addiction can deter individuals from seeking help, further entrenching them in this destructive cycle. Breaking the cycle. Successfully navigating recovery from addiction, especially with trauma, demands an integrative approach. Cognitive behavioral therapy, CBT, tackles addiction by restructuring dysfunctional thinking. Farahmand notes, by reshaping thought patterns, healthier coping mechanisms emerge. Eye movement desensitization and reprocessing, EMDR, addresses trauma by processing memories and reframing beliefs. This reduces the urge to self-medicate. Trauma-informed care, a holistic approach, acknowledges trauma's prevalence and adjusts treatment accordingly. Integrating these therapies shows positive outcomes, emphasizing a multifaceted approach to addiction recovery. Trauma's role in addiction. The evolving landscape of mental health and addiction treatment is increasingly recognizing the necessity of trauma-informed care, paving the way for more effective and compassionate approaches. The challenge lies in integrating these insights into mainstream healthcare and societal attitudes. Encouragingly, there is a growing movement towards destigmatizing both addiction and trauma, fostering a culture where seeking help is seen as a strength rather than a weakness. Advancements in neuroscientific research and technology promise more personalized and effective treatments and a movement toward recovery that is more holistic and deeply rooted in understanding and compassion.